If your pregnancy test is negative, but your body feels pregnant, you are not imagining things. This situation is very common, and today I will explain why it happens, what it means, and what to do next. One of the most common reasons is testing too early. Pregnancy tests work by detecting a hormone called HCG. In very early pregnancy, this hormone may still be too low to show up on a pregnancy test. Even tests that say you can test early are much less accurate before you have missed your period. So, if you test too soon, the result can be negative even if you are actually pregnant. This is why repeating the test after 48 to 72 hours or after you have missed your period can give a different result. Another reason is low HCG levels. While HCG levels are expected to double every 48 to 72 hours, there is a wide range of what is considered normal. Some women naturally produce HCG more slowly or start with lower levels and still go on to have healthy pregnancies. So even after a missed period, the hormone level may not yet be high enough for a urine test to detect. For the best accuracy, it's best to test first thing in the morning when your urine is most concentrated. Also, drinking too much water before testing can also affect the result. When urine is diluted, the concentration of HCG drops, and this can lead to a false negative. So, try not to overhydrate before taking a pregnancy test. Sometimes the issue isn't timing or hormones, it is the test itself. Pregnancy tests can give incorrect results if the instructions weren't followed exactly, or if the test is expired, or if the test wasn't stored properly. If something doesn't feel right, it's okay to repeat the test using a different brand. Another common reason is that premenstrual syndrome or ovulation can feel exactly like early pregnancy. The hormone progesterone rises both before your period and in early pregnancy. That is why symptoms like breast tenderness, fatigue, bloating, nausea, and mood changes can happen in both situations. Often, the only thing that truly separates premenstrual syndrome from pregnancy is time. Symptoms from premenstrual syndrome usually settle, while pregnancy symptoms usually progress. Stress can also play a big role. Stress can delay ovulation, delay your period, and cause symptoms that mimic pregnancy. When stress affects your hormones, your body can send very confusing signals. There is one important safety point I need to mention. In rare cases, pregnancy tests may be negative in an ectopic pregnancy. So, if you have severe one-sided lower abdominal pain, shoulder pain, dizziness, or heavy vaginal bleeding, please seek medical care urgently. So, what should you do next? Repeat a urine pregnancy test in 48 to 72 hours. Use a first morning urine sample. If you are still unsure, get a blood pregnancy test. And remember, ultrasound is the most reliable way to confirm the pregnancy. I know this waiting period can be emotionally exhausting. Try not to symptom spot too much. With time, your body will make things clearer. If you found this video helpful, share it with someone who might need reassurance. Until next time, stay healthy and be kind to yourself.